Good morning, everybody. Welcome to today's live update. This is the last one of these for this semester. I'm Chancellor Donde Plowman, and I'm talking to you from my home, where I'm quarantining after being identified as a close contact of someone who tested positive. There's also a little background noise going on here, and I apologize for that. Workmen outside. This morning, I received a negative result from a COVID test I took yesterday. I'm feeling well with no symptoms and will continue to quarantine according to CDC guidelines. This has been another reminder of the need for all of us to take this virus and all of the recommended health and safety protocols seriously. It's especially true as cases are spiking locally and around the country. We also have several big holidays ahead. I want to urge you all to be careful in how you celebrate. Continue to social distance, wear masks, and be safe. Now, today I have with me Dr. Gregg, Director of our Healthcare Center, Vice Chancellor for Research, Deb Crawford, and Vice Chancellor for Student Life, Frank Cuevas. As always, we're going to go over the data, and then we will look ahead to what students can expect for the spring semester. As a reminder, before we get started, next week our students will be leaving campus for the remainder of the semester. It is important for them to make a plan for their departure. This plan should include 1, scheduling a flu shot, 2, get a COVID test. Thanks to SG and the Student Health Center, students can get a free take-home testing kit today at the Rock from 12 to 4 p.m. So show up at the Rock and they will be handing these out free. There's no reason for people to not get a test. Be sure, number 3, and pack up all the material they need for their final exams. For more information on how to prepare for the winter break, please visit tiny.utk.edu/make-a-plan. Now, let's go over today's data update. So, as of yesterday, we had 86 active positive COVID-19 cases. 73 of those are students and 13 are employees. This total includes 6 new recoveries. So that's positive cases we've taken out of that number that because they have completed their 10 days. Now, the next slide shows that there were 10 new cases that were reported yesterday. Again, those 2 lines, those 2 graphs look, as you would expect, very similar. The next graph shows that we now have 578 people in quarantine or self-isolation. Like that quarantine, that's one of those is me. Of those, 484 are students. So again, you see that that line has been flat, but it's growing back up. Looking at our community testing, last week we collected 713 samples from residents in North and South Carolina Calls, Fraternity Park, and through makeup tests. We had about a 60% participation, a little less than we like. The samples were divided into 236 pools of 3 to 4 samples in each pool, and we had 35 samples that required for further testing. So far, of those 35 samples, we've had 6 individuals test positive for the virus. Okay, Dr. Gregg, let's go to you. What are you seeing in this data?
Good morning, Chancellor. It's good to be with you again today. And
Thanks.
it's good to know you're doing well. As we look over this data, there is a concerning trend of an increase in active cases. First, we see that the number of students residing in both on and off campus having to isolate or quarantine is increasing, as is the number of employees. This reflects what we're experiencing with the Knoxville community, although the rate of increase doesn't appear to be as great on campus. The largest increase appears to be the number of those that are having to quarantine because of being a close contact with a positive case. The average number of new positive cases for the past couple of weeks had remained relatively stable on campus, but it's higher now than in previous weeks. And again, this is just similar to the community at large, only the rate of increase doesn't appear to be as great on campus.
So as students begin making their plans for departing campus and spending winter break at home, what should they be doing, Dr. Gregg? How should they be thinking about Thanksgiving and other holidays?
Well, as we finish out this semester and prepare for the break and holidays, it's imperative for everyone to stay mindful of appropriate health and safety guidance to prevent exposure and spread. If you've not already done so, you need to start preparations now. First, if you've not received the flu vaccine, get it before you leave. The Student Health Center Pharmacy has the vaccine, and appointment's not required to get it. Drop by and get one, both students or employees. It only takes a few minutes of your time. Make sure you get a COVID test before you leave. Those are also available at the Student Health Center, both for students and employees. As you said, we'll even be distributing those test kits at the Rock today between 12 and 4. After you've been tested, self-isolate until your results are back. Once you've received the results, if positive, the contact tracers will assist you in regard to your next steps. If it's negative, then you should continue to separate yourself from others as much as possible. That way, you reduce the likelihood of exposure before you leave. Continue to practice health and safety measures prior to and during your return home, as well as upon your arrival at home. If you're sick, stay home and away from others. Practice physical distancing by staying at least 6 feet away from others whenever possible. And if you must be within 6 feet, limit that duration and frequency as much as possible. Don't forget to wash your hands or use hand sanitizer regularly, and avoid touching your face. Remember to clean frequently touched surfaces before their use. And don't forget to wear your mask, not just here on campus, but everywhere. And finally, the CDC lists some important safety tips specifically related to travel during this time. And I encourage everyone to take a look at that information prior to implementing any specific travel plans.
One last question. How can students, when they get home, they want to see their friends, their family, how can they do that and be safe?
Well, honestly, it's going to be tough. I encourage everyone to closely adhere to the guidance that we've just discussed. In addition, on our COVID website, we posted a link to some great information from the CDC regarding safely celebrating the holidays. You can also find that on the CDC website by typing Thanksgiving into the site search box. I also encourage you to closely consider your plans for gatherings. If you must participate in gatherings, where, by the way, the highest likelihood of spread is occurring, then it ought to be limited to the outdoors, keeping your distance, wearing your mask. If indoors, ensure there's adequate ventilation by opening windows while still keeping your distance and wearing your mask. Limit the number of those involved in a gathering. We've seen the greatest spread in small group gatherings, even of just 4 to 5 people, but typically it's where safety guidance isn't being strictly followed. You've got to have conversations with your guests ahead of time to set expectations. If you feel those in attendance aren't likely to adhere to safety guidance, then I would give serious thought to not having the gathering at all. Look, the vaccine is just around the corner. I know it's been difficult for all of us, but just adhering to guidance can go a long way in keeping you and others safe from exposure. Don't let your guard down. Remain vigilant. Unfortunately, there's still going to be circumstances, regardless of how safe we try to be, that exposure is going to occur. It's not inevitable, but it can still happen. And if it does, then do what's right to keep others safe. Get tested and quarantine yourself. Chancellor, we've got to accept that these holidays aren't going to be like any other that we've experienced, but we can safely get through them.
I agree with that. We just had to change our family's plans. And while it was disappointing, it was the right thing to do. And we'll all be together next year. As students head home for final exams and winter break, we want to start thinking about the spring semester. There's been a lot of work behind the scenes to prepare for the upcoming term, including adjustments to our community testing protocols. The saliva testing has been our most useful tool to monitor the prevalence of the virus on campus so that we can make informed decisions. With that in mind, we will be moving to weekly sample collection for all of our on-campus residents. and we're working to make the process as easy as we can for them. All the new testing dates are on the campus calendar to make it easier for students to plan. We are also expanding the opportunity to off-campus residents. Dr. Crawford, who's been leading our community testing strategy in partnership with Dr. Gregg, is here to talk about our strategy this spring semester. So, Dr. Crawford, thanks for joining us. First, before we get into testing protocol, I know we've all been watching with great interest, the news on advances in a vaccine for the virus. How could that affect our plans for the spring semester, if at all?
Good morning, Chancellor Plowman. As we prepare for Thanksgiving week, we want to give thanks to the thousands of scientists who've worked so hard to create safe, effective COVID-19 vaccines, and to the hundreds of thousands of volunteers who've participated in their clinical trials. We learned in the last 2 weeks that we have 2 vaccines reporting efficacy of about 95% with no serious safety concerns. You can't do a whole lot better than that. And there's a number of other promising vaccine candidates in the pipeline. But the bottom line for our community is that these vaccines probably won't change our spring semester plans. It'll take some months for Pfizer and Moderna and other companies to ramp up their manufacturing capacity in order to vaccinate, well, basically the entire world. So starting in January, the first batches of vaccine will be made available here in the US to frontline workers like doctors and nurses and EMTs who treat the sick. It'll also be provided to those more vulnerable in our communities, like our beloved elders. It's not likely that we'll be in a position to vaccinate broad swaths of the US population, and that includes most of our students, faculty, and staff, until the summer of 2021 at the very earliest. So we'll start spring semester with a sense of purpose and optimism, and having learned a lot from the experiences we've had and shared in the fall. We'll ask everyone to be sure to continue to 1, mask up, 2, follow social distancing and other safety protocols, and 3, participate fully and willingly in the university's comprehensive testing protocols, always mindful of the impact of our own decisions, not only on ourselves, but on everyone in our community.
Okay, thank you. So let's just move on to the testing. What can our students expect this spring when it comes to this community testing?
As you mentioned, Chancellor, we'll ramp up significantly our community testing in the spring. We'll have capacity to test about 8,000 students every week as part of our pooled saliva program. All students living on campus will be required to provide us with a saliva sample each week. That means all residential students participating in community testing will be able to monitor prevalence of the disease in our dorms and our Greek houses, and we'll be able to proactively fine-tune our actions to keep our campus community safe. We can't hear you, Chancellor.
Trying to tune out the workman. How will the testing program for off-campus students work exactly? And what are the advantages of being included in that pooled testing?
So our off-campus students living in Knoxville, and it's important to make that distinction, will be able to participate in our community testing in the spring by bringing their saliva samples to collection sites on campus. That means that we'll be able to proactively monitor presence of the disease in that population. So the data we collected this semester from testing symptomatic students and their close contacts suggests that there was little difference in disease prevalence among our off-campus and our on-campus student populations. But we didn't have the capacity this semester to offer our off-campus students the ability to participate in our pooled saliva testing program. Next semester, they'll be able to do so.
Okay, so thank you so much for that. The pooled saliva testing has been so helpful. we call it community testing. It's a way for us to keep our students safe while allowing as much activity as is safely possible on campus. Of course, participation is critical to the success of our testing program, and our pooled saliva sampling will be required. It will be required for all on-campus residents. And we also want to reward them for helping our community through their participation. So, Dr. Cuevas, this is for you. How exactly will we be rewarding students for participating in the community testing?
Thank you, Chancellor. As you mentioned earlier, our current participation rates were around 65, 64%. And what we're trying to do in the spring semester is really incentivize to have our students to be real engaged in our community testing program. So we're gonna have a number of individual awards, might be Vol Shop gift cards, might be Vol Shop items, other perhaps food delivery service gift cards. We even have a residence hall room makeover for students to encourage to participate in our community testing. We're also planning some larger group programs for groups that have high participation rates or residence halls that have high participation rates. So we're really taking a full community approach to really encourage our students to be part of our community testing program.
That is definitely what I would call the carrot. Very. So what else can students expect this spring, Dr. Cuevas?
Well, for the spring semester, we're going to work on keeping everyone on our campus healthy and safe. So aside from all the community testing that will occur, we're also going to be working to really continue to improve and enhance the volunteer experience. The thing that makes Rocky Top special is that volunteer experience. We know after being gone for winter break, students are going to want to come back and reconnect with one another. So we're going to do that in a safe manner, encourage that through different programs that we're going to offer on campus. So students are going to see enhanced programs, enhanced activities that we are planning for them to really reintegrate them back to campus, to welcome them back and to get them connected, because we know after being gone for a little bit longer period, they're going to want to see one another. And we're going to try to facilitate that in a way that is healthy and safe.
Fantastic. So one final question. As students leave campus for the final time this semester, what message do you want to leave them with?
Well, I want to first begin by thanking them for their resiliency. We're near the end of the term. This has been a term unlike no other for all of us, for our students, our faculty and staff. And I want to thank them for doing their part to help really keep our community healthy and safe. Their participation rates in our community testing program and their flexibility as we have hybrid type programs and so forth. So I want to remind them the term's not over yet. We need to finish strong. We have finals coming up. As you shared earlier, take what you need home so that you have what you need to be successful in those last few weeks. I want to remind them to also stay healthy and to be safe. As Dr. Gregg mentioned, follow CDC guidelines when you're at home. Just because we're in our comfort area doesn't mean we need to be a little bit lax. You know, there's hope. Hope is right around the corner. We have 2 promising vaccines and many more in the pipeline. So I do hope that, just want to remind our students to be safe, be healthy, and that we look forward to them returning in January.
Doctors Gregg, Crawford, and Cuevas, I want to thank you for being with us today. And you've been on this every week, all semester. I want to thank you very much for that. And I'm just going to do a shout out here. We did get, UTK got a rating of A, like A through F, we got an A, by a group of very respected academics and doctors who looked at our dashboard on our website. And we got that grade for high marks for ease of use, breadth of the data, and the regularity of the updates. So I'm going to include in that these updates as well. So thank you very much. And I want to thank everyone who tuned in today, who's watching and who's been watching all semester. We will be back in January doing these. And in the meantime, we will communicate all critical information through our typical channels, including email, social media. So make sure your inboxes throughout your time away. Please, everyone, have a safe Thanksgiving. We have much to be thankful for, in spite of all of this. And good luck to all of our students on your final exams. Thanks, and go Vols.